sorrow that a provider is going to feel in losing a child. But one of the things that they have to try to remember, or hopefully will remember, is that no one knows what causes SIDS, no one can predict SIDS, and there's no way to stop SIDS. The other thing is that we do have support available through the Department of Human Services, through their daycare licensing rep, or through their center supervisor. Also through the Department of Health, where we can send out a county nurse that can talk with them about SIDS and what it is about. The other thing also is that we do have an Oklahoma chapter of the SIDS Alliance, which is a parent support group. Now, it is primarily for parents, but they can provide support to the care provider.
Pat Dameron, thanks so much for visiting with us today. We really appreciate it.
Thank you for having me.
And those numbers that Pat mentioned are on your screen right now.
Well, we've covered many important topics, but we do have a few more items to discuss.
When licensing visits your facility, we normally introduce ourselves to the director or the staff in charge. We also can be identified by the notebooks that we normally carry and a copy of the Child Care Center requirements. We proceed with our visit. We are checking for minimum standards. We also look for hazards and check the floors, the walls, bathroom, and the playground equipment. We appreciate when you as staff members introduce yourself and the age group you are working with. Helping with grouping children together that are mixed especially is appreciated when children are playing outdoors or in mixed groups. This helps us to identify which children are with which staff member and to get a more accurate count. We count children and the number of staff that are with those children. We make sure that the center is within their licensed capacity.
The staff ratio for infants 0 up to 12 months is 1 staff to 4 infants. Maximum group size is 8. The staff ratio for toddlers 12 months through 23 months is 1 staff to 6 toddlers. Maximum group size is 12. The staff ratio for 2-year-olds is 1 staff to 8 2-year-olds. Maximum group size is 16. The staff ratio for 3-year-olds is 1 staff to 12 3-year-olds. Maximum group size is 24. The staff ratio for 4 and 5-year-olds is 1 staff to 15 4 and 5-year-olds. Maximum group size is 30. The staff ratio for 6 years old and older is 1 staff to 20 children, 6 years old and older. Maximum group size is 40. Refer to Appendix L4 for the other staff-child ratio options.
Why do we have staff ratios? Child ratios are based on what children need in order to receive a reasonable amount of quality care from teachers. Examples might be the toddler ratio, which is 6 to 1 staff member. Toddlers need a greater amount of care, holding, feeding, diapering, and a lot of love. In contrast, the 4s and 5-year-old ratio is 15 to 1. As you can see, these children are more independent, self-sufficient, they feed themselves, and they are able to toilet by themselves. But attention is important, and also guidance and affection from the teachers. Remember that these are minimum ratios. Many centers use even lower ratios to increase the individual attention to each child. For instance, this 3-year-old group of children, the maximum group size is no more than 24 children with 2 staff. The purpose of limiting group size is to encourage the following: teachers' involvement with each child. In small groups, children tend to show more cooperation, sharing of thoughts, less hostility and conflicts between children. They are more involved, and children get more attention from the caregiver. You will be thankful for these limits because they allow you to be more effective by cutting your stress levels. There will be less demands and problems with children's behavior. Children will work together because they don't have to fight for your attention. You will be able to provide quality care to your group of children. An important part of providing a quality program is making sure that you have a good quality inventory. Your inventory should have age-appropriate toys and equipment. Especially if you are dealing with the 2-year-olds or the 3-year-olds, you would like to have a good selection of toys where there won't be competition for several items. As here we see two cars so children can play and not have to compete over the one car. We also see that in this room, the tables and the chairs are appropriate to the children's sizes. Children are learning as they play. For instance, large muscle development. This is in activities that are outside with large muscle climbers. Also, fine motor development is enhanced with toys such as Legos or table activities that can be seen in this grouping. Language development is enhanced through books and also puppets. These might be some areas that you would have to enhance language skills. Also, pretend play, such as the housekeeping area where you see dolls, cribs, different types of kitchen or housekeeping areas, help the children in learning life skills for the future. A copy of the equipment inventory is found in Appendix L5. Remember to check your equipment often. Alert your director if you find equipment that is broken or needs repair. Broken equipment can be hazardous to children and should be removed from their play area. Licensing workers are frequently asked questions about supervision. Let's start with infant through 2-year-old supervision. These groups must be supervised at all times, even if the staff member needs to take a phone call, a bathroom break, or any kind of break away from the room. Staff must be able to see and hear the children at all times and be in the room. Why? They require constant supervision. Infants through 2-year-olds can get into dangerous activities within moments. It is critical that the staff member is able to act quickly. The teacher can prevent problems before they happen. School-age children need less supervision. As children grow and mature, they become more responsible, more self-sufficient. School-age requirements allow that children who are responsible and have a good understanding of the center's rules and appropriate behaviors can have the privilege of taking part in short-term activities that are not within the vision or hearing of staff. The staff, however, must make personal contact at least every 10 minutes and must know the whereabouts of each child in their care. Nap time supervision. Standards do allow for staff to take short breaks on site. If you're out of the building, you cannot be counted into the staff ratio. In case of an emergency, you must be there to help with the children. Remember, however, one staff member must be able to supervise. An example would be a staff member sitting in the hallway where you can see between 2 classrooms. This does not apply to infants through 2-year-olds. As we discussed, a staff member must be present at all times with these groups. Another point to remember is light level at nap time. There must be enough light in a room so that you can see the faces of children.